This is the Nottingham Nation's NHS Treatment Centre. It is one of the state-of-the-art independent sector treatment centres, which is specifically designed for day case surgery. This video is to help you understand what will happen when you have your veins treated using one of the latest techniques of keyhole surgery called endovenous ablation with the radiofrequency system. The technique can also be applied for the treatment of veins with a laser or other forms of thermal ablation of the vein. Patients who have this treatment will be able to walk into the hospital and then go to the treatment area where they will be seen by the nursing staff. They'll be shown through to where they can change into their dressing gown prior to the procedure. Your clothes will be stored in a locker for security. It may be that before the procedure you have an ultrasound scan. For some patients, the ultrasound scan will take place at the time of the first outpatient appointment. The purpose of the scan, which is either done by a surgeon doing the procedure or possibly a vascular technologist, is to identify where the problem is in the varicose veins and to make sure that your vein is suitable for treatment with the new endovenous technique. The ultrasonographer will use a probe and some jelly to look at the vein to ensure it is of the right size and type for treatment with the keyhole technique. The sonographer will almost certainly ask you to sit up so they can examine the veins around the back of your knee and the deep veins. Whether you've had the ultrasound done on the day of your treatment or prior, you will then be taken through to the treatment suite. This might be a big main operating theatre with many staff in it, but it may also be a very small room with perhaps only one or two members of the nursing and operating team who will help look after you during your treatment. You'll be asked to lie down on the operating table or couch. There will usually be a member of staff who will be able to help look after you if the treatment is being done under a local anaesthetic. Before the procedure, the staff will check that they have your consent to carry out the operation. It can be quite noisy in the operating theatre, and the surgeon and their team will spend some time getting the equipment ready to perform the procedure. During this time, you might feel a bit nervous, but there is no need to worry, as a member of staff will be able to talk to you and tell you what is going on in the theatre. Before the procedure, it is necessary to clean the skin of the leg, and therefore your surgeon will use some antiseptic solution. Usually the surgical team will have warmed this up so that it is not cold on your skin. If cold solution is used, it can make the veins more difficult to treat, and therefore you may wish to remind the staff to use a warm solution. Before anything gets started with the treatment, your surgeon will prepare all the necessary pieces of equipment, which includes some needles and tubing, and they may be able to explain to you what they are doing before they start the treatment. Your leg will then be cleaned up with antiseptic solution, and if your operation is done under a local anaesthetic, as in this case, you'll be asked to move your leg around to help the medical staff clean the whole of your leg prior to the operation. As you can see here, both the front and back of the leg have been treated. For some patients it can be slightly embarrassing having the treatment under local anaesthetic, but you'll be carefully looked after, and for some it may be worth wearing either swimming trunks or a bikini bottom to help with your dignity. After the leg has been cleaned, the medical staff will place clean cloths so that the whole area is sterile, and you may have your foot placed in a small sock. The whole procedure is done using ultrasound, and so your surgeon, and if they are using a technologist's help, will prepare various pieces of equipment which will allow them to use the ultrasound in a sterile sleeve. You can see this being put together in this image. You will also see that having a nurse to help look after you during the operation will be relaxing, and therefore you shouldn't worry about the procedure itself. As the procedure starts, the surgeon will place some more jelly, which can be cold on your thigh, and this then allows them to perform an ultrasound to check they know exactly where the vein is before they start. The first part of the procedure will be the administration of some local anaesthetic, and this involves a very small needle, which can sting slightly, and there's a little bit of burning before the surgeon places tubing and a needle into the vein. It might be possible, if you want to watch on the ultrasound what the surgeon is doing. And in this image you can see a needle being passed into the vein, which allows the surgeon to place the necessary equipment inside the vein that's going to be treated. In this image the surgeon is passing a very fine wire into the vein, which will allow them to guide a larger piece of tubing called a sheath into the vein, and it is through this sheath that the applicator will be passed. This allows the treatment of the vein in your thigh. Once the surgeon has managed to pass the wire and the sheath into your vein, everything is set to start the operation. For some surgeons it can be difficult if the vein is very small, and you must be prepared for the procedure to be abandoned and perhaps be brought back on another day if it is not possible for the surgeon to place the guide wire and sheath. Once the sheath has been placed, your surgeon will then pass the applicator, which is a fine piece of wire, into the vein, and it is this that will heat up the vein and stop the blood running in the wrong direction. This will treat the varicose veins that have been troubling you. As you can see, this part of the operation is not uncomfortable for this patient, and she's able to chat away to the staff nurse while the procedure is taking place. The surgeon will use the ultrasound to make sure that the applicator is in exactly the right place to start the treatment. They will have to pass the applicator to the top end of the thigh if they are treating your vein in the upper leg, and to behind the knee if it is in the lower leg. This image of the ultrasound shows the applicator tip in the correct position. Once the catheter is in position, your surgeon will then be able to prepare the local anaesthetic. This needs to be injected around the vein in order to numb the area before treatment and also to squash the vein onto the applicator. The local anaesthetic is sterile and comes in a bag which has been prepared by the nursing staff before the procedure commences. Many surgeons now use a special pump system which allows them to inject fluid gently into the thigh, giving the least discomfort to their patients. In this image you can see the surgeon is using the ultrasound and a needle to start to inject fluid into the thigh. Your surgeon will try their very best to limit the number of injections you need into the thigh, but you must be prepared to have several injections during the procedure so that a local anaesthetic can be passed all around the applicator. In this image you can see the ultrasound of the vein being squashed by the fluid. This part of the procedure can take 4 or 5 minutes, and it is the part that some patients find slightly uncomfortable. If you do find it uncomfortable, remember that the operation is being done under a local anaesthetic, and that means you'll be able to get up and walk away very quickly after the procedure. You'll see that for this lady having her treatment, it's not causing her undue problems as she's able to chat away to the staff nurse. The surgeon will be concentrating on getting the fluid into exactly the right position using the ultrasound and the needle. This is to make sure that everything is perfectly placed before your treatment commences. Once the surgeon is happy that the vein has enough fluid around it, they will double check by passing the ultrasound down your leg to make sure that the vein is completely surrounded by anaesthetic, as can be seen by the ultrasound image in the bottom right. This ensures that you will have no discomfort during the treatment phase of the procedure. Once the surgeon is happy with the placement of the applicator, they will then plug the heat-sealing device into the generator and start treatment. With the Olympus system there is a high-pitched noise which the surgeon uses to determine how quickly they should pull the applicator down the vein. You must be prepared for this noise, so do not worry about it. It just shows that the treatment is taking place. The surgeon is able to record how long it takes to do the treatment using the clock on the generator system. Most treatments only take about 1.5 minutes. Once the vein has been treated with the radiofrequency system, the surgeon will then check that the vein has the appearance of treated tissue, and then your operation is almost complete. Once your surgeon is happy with the treatment, they will clean your leg and place a sticky plaster over the small hole that has been made where the sheath was put in. For some patients, they may then go on to have small nicks placed in the skin to remove varicosities. This is a process called avulsions. But for this patient it was unnecessary for her to have any further treatment, and therefore after her vein was sealed she was placed into a stocking and was able to get up and walk from the operating suite back to her room. Some people can feel slightly faint after they've had the procedure, so you will always walk back with a member of staff who will be with you. One of the great advantages of having endovenous ablation under a local anaesthetic is that within a few minutes you can be changed back into your normal clothes and can be taken home, walking out of the operating suite. As you can see, with one of the modern state-of-the-art hospitals, it is easy for patients to walk in, have their veins treated, and then leave the hospital in a matter of an hour or two. If you'd like any further information about what you've seen in this video, please discuss it with your GP, your specialist vascular surgeon, or you may find the following websites of interest.